again to Pathology Snippet 2. I hope that people who are watching this video have previously watched the video of Pathology Snippet 1, Glycogen Storage Disorders review. Again, introducing myself briefly, I am Dr. Amey Anil Munemane, founder president of BBDMC Quizzing Society and intern Bharati Vidyapeeth Medical College, Pune. Let us start with the second snippet, that is Glycogen Storage Disorders MCQs. Now in this snippet, I'm going to quiz you with 3 MCQs. And this will be a good judgment of yourself that I've just taught you a topic. You have just learned a topic, but how far are you able to recollect and apply it in the form of MCQs? So let's start with the first question. Now, before going with the questions and discussion, let me tell you something. I frankly believe that a person who can read an MCQ properly has a 50% chance of solving the MCQ correctly instead of the conventional 25%. Now, the technique I'm going to share with you has been taught to me by my DAMS pathology faculty, Dr. Sanjeev Chitragar sir. He teaches pathology really well, but his MCQ approach technique is excellent. So we'll be studying and discussing MCQs henceforth in the coming snippets according to Dr. Sanjeev Chitragar sir's technique. His technique is as follows. Number 1, read the last line of the question. Number 2, read the options. Based on the options, try to figure out the question has been set from which topic of the subject. Number 3, do not read the whole question. Just read the keywords of the question. From the keywords, mark the answer and go ahead. Let us follow his technique. For MCQ number 1, the most likely diagnosis is A. Pompey's disease, B. McArdle's disease, C. Torrey's disease, D. Anderson's disease. Oh, this has been set from the topic of, yes, you guessed it right, glycogen storage disorders. But hey, all are glycogen storage disorders. So just knowing that it is a glycogen storage disorder will not help me in answering this question. The only way I can answer this question is if I know the clinical features specific to each glycogen storage disorder, which has been discussed by me in the previous mnemonic. Let us read the keywords of the question. There are only 2 keywords in this question. Number 1, 6-month-old baby, signifying that it is from a pediatric population. Number 2, concentric left ventricular hypertrophy, signifying that it is a cardiac symptom, so heart. If you remember the mnemonic of Pompey's disease, I had told you P for Pompey, P for pediatric. Apart from crying and playing tantrums, pediatric population has a good heart. So Pompey's disease will have all the symptoms related to cardiovascular system, that is heart. So the answer to this question is Pompey's disease. Moving on to the next MCQ. The most likely diagnosis is A. Von Gierke's disease, B. Corey's disease, C. McArdle's disease, D. Her's disease. Muscle cramps on exercise and myoglobinuria are the keywords. Sorry, it's not myoglobinemia, typing error from my side. I apologize, it's myoglobinuria. These are the 2 keywords. Remember the mnemonic I told you. M for McArdle, M for muscle cramp, M for myoglobinuria, and even the enzyme which is starting from the letter M, muscle phosphorylase. Everything in McArdle starts with the letter M. Answer to this question is option C, McArdle's disease. Moving on to the next question and the ultimate question. The most likely diagnosis is A. Anderson's disease, B. Von Gierke's disease, C. Limit dextranosis, D. Lewis disease. The keywords in this question are 1-month-old infant, Okay. Hypoglycemia, hyperuricemia. If you remember, I have taught you in the clinical features of last video that whenever a glycogen storage disease presents as hypoglycemia and hyperuricemia, it is von Gierke's disease. So the answer is option B, von Gierke's disease. Now, I would like to tell you the 5 clinical features that you must absolutely know if you're suspecting a glycogen storage disorder in the clinical question. I request you again to take out your notebooks when you're watching this segment of the video and write it down. The first one is in a glycogen storage disorder, if you see hemolytic anemia, it is Torre's disease. Torre's disease is glycogen storage disease 7. If in a glycogen storage disorder, you see in the vignette written cirrhosis and early death, the answer is Anderson's disease. If in the clinical question you see cardiomyopathy, it is Pompey's disease. Very obvious. If you see in a clinical vignette hyperuricemia, it is von Gierke's disease. And lastly, the 5th point, if you see muscle cramps and myoglobinuria in your clinical question, the answer is McArdle's disease. Now, as promised, I'm going to revise with you the mnemonics that I shared in the previous video. So mnemonic 1 was related to the names of the glycogen storage disorders from GSD 1 to GSD 6. The mnemonic is वो physics और chemistry में होशियार था. वो von Gierke's disease type 1 glycogen storage disorder. Physics Pompey's disease GSD 2. Here there is an alteration in the mnemonic. That is why I am stressing this point. Please remember, I have said or first in the mnemonic, but Anderson's disease or is GSD 4 and not GSD 3. I repeat, Anderson's disease is GSD 4. Chemistry, Corey's disease GSD 3. May, McArdle's disease GSD 5. Hoshiyar, Her's disease GSD 6. Tha, Torre's disease GSD 7. Mnemonic 2 was regarding the enzymes of the glycogen storage disorders. 16th prime minister is ABCD MMHH. 16th can be broken down into 1 and 6. So first glycogen storage disorder is, yes, you said that right, von Gierke's disorder. Von Gierke's disease has the enzyme deficiency 6, that is glucose 6 phosphatase. PM, that is prime minister, P for Pompey's, has the enzyme deficiency M, that is acid maltase or lysosomal maltase. AB, that is Anderson's disease, which is your GSD. Very good, it is GSD 4. Anderson disease has enzyme deficiency branching enzyme. Corey's disease, which is GSD 3, has debranching enzyme deficiency. MM, that is McArdle's disease, has enzyme deficiency muscle phosphorylase. HH, Her's disease, has enzyme deficiency hepatic phosphorylase. Third mnemonic about Pompey's disease, which is glycogen storage disorder 2. Pompey's disease, P for Pompey's, P for pediatric. What do pediatric population have? They have a good heart. Because they have a good heart, all the symptoms related to Pompey's disease will be in cardiovascular system. So cardiac failure, cardiomyopathy will lie with Pompey's disease. And the last mnemonic is GSD 127 gap. That means the enzyme deficiencies in GSD 127 are gap. GSD 1 has glucose 6 phosphatase deficiency. GSD 2 has acid maltase deficiency or lysosomal maltase or lysosomal 1,4-glucosidase. GSD 7 has phosphofructokinase. For GSD 2, there is one more mnemonic. Pompey thrashes the pump. In the word Pompey, the word P has come in the first and the fourth. So the enzyme deficiency is lysosomal maltase or acid maltase or lysosomal acid alpha 1,4-glucosidase. That's all with the revision of mnemonics and the MCQ discussion. I hope you like this video. I hope this video was up to the standards which you expected. Lastly, if you like the video, please like it and subscribe it and share it with your medical colleagues, friends, and doctors so that they can enrich their understanding of glycogen storage disorders. Thank you.